Alright, we're here to talk about filling of the upper lips. And Jess has a good full lower lip, but the upper lip, she could really use a little bit right in the pink part of the lip. So what we'd like to do is fill it in subunits, so the right side, central, and left side upper lip, to give her just a little more body in that area to match the nice lower lip. So, that's it. Okay, so we're all numbed up and ready to go. I do advise doing a nerve block for these. I didn't show the nerve block, but I do advise doing that. I think it makes the patient a lot more comfortable during the actual procedure. Some people use topical numbing medicine. Surprisingly, some don't use any numbing medicine at all, and I guess some patients are really tough, but we always assume that patients are not and want to be the most comfortable. So even though the Juvederm is what we're using today, it is mixed with lidocaine in the XC version. That helps to make it more comfortable, but still a nerve block I think is the best way to go for the lips. So I like to use the blunt cannulas. I feel like they make a really big difference as far as decreased bruising, and especially in the lips where if you do inject the lips, they're going to swell quite a bit anyway. So if you get a bruise, it's going to swell even that much more. So made a little insertion site already, and I'm just going to gently pass the cannula into the lip here. You feeling that?
Not really.
Just going to inject them all the way out. So one of the things to point out is sometimes you do have a limitation as far as the volume, the actual skin, or in this case mucosal envelope of the lip. And if there isn't a lot of space there to fill, then it can be kind of diminishing returns, or you can try to chase it and try to fill it a little too much, and then the lip just ends up coming out instead of coming down. So you only take what it'll give you, basically. Okay, so we've done the right upper lip, and it's a little limited by the soft tissue envelope that we had there, so weren't able to quite get it to come down as much as I'd like to, but I think it's going to make a really nice filling. I also did the central upper lip there, and again, the subunits that I talked about, the right lip, the central upper lip, and then the left one we haven't filled yet. So just to show kind of a comparison, it's going to be a little swollen out in this area. I didn't put any in the white lip at all. I don't like putting any in the white lip. That's just swelling in reaction to what we did in the lip there. I also did just a little bit in her right lower lip because she was a little asymmetric. We talked about it a little ahead of time. She had a little more fullness in her left lower than right, so we just put a little bit more in there to try to match that. Okay? So, you want to take a look and see between the two sides?
Oh, wow. Looks really good.
Like it?
Mm-hmm.
Good. Okay, we'll do the left side now. Good, okay, so we just finished up, and as you can tell, it looks swollen, and I always tell patients if you don't look swollen when you leave here, we haven't done enough. The lips just swell so easily, they're so vascular, as most people know. If you just gently bump yourself in the lip, they really swell, and so filling, especially with a cannula, is no different. Again, the cannula advantage is that there's less bruising. I don't think she's going to have any bruise, maybe just a hint over here, and that helps to limit the time till which the swelling goes down, so if you don't have much of a bruise. So usually with filling the lips, no matter how you do it, you're going to have some swelling for a couple of days. If you can make it past that, usually try to do it on like a Friday, Thursday, or something like that, so that you have the downtime of the weekend or during the week, whichever works for you. So you won't be self-conscious about that. But once that goes down and this initial swelling goes down, then patients are very happy. I've had very few people ask to have the effect reduced. In fact, 1 in 6 years. So, so yeah, a little bit swollen. Ice as much as possible tonight, tomorrow, kind of 20 minutes on, 20 minutes off. That'll limit how long it swells. And then we'll see you back in a week. Okay, great.